Hi, I'm Nicole Reynolds, Lead Navigator with Wellspring Solutions. Thanks for joining us today. We are going to be talking about safely choosing respite-related home and community-based services, and we will include things to consider during a pandemic. Home and community-based services are intended to let people stay in their homes rather than moving to a facility for care. When choosing a service, you will want to consider your loved one's needs and abilities, as well as your needs as the caregiver. I'm with my coworker Judy, and we are going to role play a conversation. I'll be talking as myself, and Judy is a caregiver needing information. Here is the scenario. Caregiving for 87-year-old aunt who has dementia. Concerns about safety at home and cannot be left alone. Since COVID, Aunt has not been able to see friends and family. Aunt needs mental and physical activity. Caregiver works part-time. Caregiver needs respite. Hi, Judy.
Hi, Nicole. Thanks for meeting with me today. I really appreciate the information you sent, but I still have a few questions about your services. So if you could kind of explain each one of them to me, I would be really grateful. My aunt is 87. She has dementia. She's still able to do things, but because of COVID, she has not been able to see friends and family. She can't go to church, and quite honestly, I need a break. I'm still working part-time, but that's not really a break for me. My husband and I have not been able to do anything on our own or together for a while, so I was wondering what you might have available.
Well, it sounds like your aunt might be a good fit for our Connections program. Our Connections program is from 10 to 2, and it offers an opportunity for those to socialize and be around others. We do a variety of different programs and activities, incorporate some mild exercise, and we serve a nutritious lunch. It offers an opportunity for them to be in a safe and stimulating environment, but also offer you a bit of a break as well as the caregiver, and peace of mind that she is being taken care of to give you an opportunity to take care of yourself.
That sounds like a really neat idea, but I'm not sure the hours are going to work for me. Do you have any form of transportation?
So Wellspring Solutions personally does not provide transportation, but we do have some public options of door-to-door service that we can connect you with to help get your aunt to the program.
Okay. I'm still a little iffy about the hours, so can you tell me what other services you might have?
Sure. So we also have our Memory Care Center, which is our full-day program. And the Memory Care Center is open Monday through Friday, 7:30 a.m. to 5:30 p.m. We serve breakfast, lunch, and an afternoon snack. So again, we incorporate the nutritious meals into the day. And our Memory Care Center has a special certification from the state. So we are only serving members that have a diagnosis of dementia. And because of that, we've done a lot of research on evidence-based practices to incorporate into our programming that has been found to be therapeutic and beneficial for those that have dementia. So we incorporate a lot of art and music, mild exercise. Judy, we also have staff at our Memory Care Center that can provide additional assistance with any personal care needs that your loved one may have. We have certified nursing assistants that can provide assistance in the bathroom, making sure that they're safe ambulating around the center. And we also have a nurse part of the day as well, who can help with medical monitoring if there's any conditions, blood pressure, things like that, and also help to administer medications if that's necessary while they're at the program.
That sounds like a really great program. Can you tell me what kind of safety protocols you've had during COVID and how I can be assured that my loved one would be safe?
Sure. So right now we are not allowing anyone to come into the program other than staff and members. So we have a system where you pull up to the front when you're dropping your loved one off. Our staff will come out to your vehicle. They'll check your loved one's temperature. They'll ask you the COVID screening questions. They'll ask if they've had any symptoms, if you've been in contact with somebody that is diagnosed or suspected of having coronavirus. And if they answer no to those questions, then we'll bring them into the program. We're also screening our staff daily, checking their temperatures and asking the same screening questions. Our staff are masked and wearing face shields. And one of the newest protocols that we have in place is we are requiring all members to be vaccinated.
Okay, that sounds really good. Now, if I wanted my aunt to come to the program, I don't think she would want to come 5 days a week. Does she have to come a certain number of days, and does she have to stay the full time during the program?
So she does not have to come all 5 days. So we do recommend 2 to 3 days a week. The only really requirement is you have to come the same days every week.
Okay. And the hours, does she have to stay all day?
She does not have to stay for the full day. However, the cost is the same regardless of how many hours you're there.
And in talking about cost, does Medicare pay or her insurance pay for the program?
Unfortunately, medical insurance does not cover our programs, but we don't want finances to be a barrier to someone joining us. So we do have some grant funds and other funding opportunities for those that might have difficulty paying privately. Is your aunt a veteran?
No, I'm sorry, she's not.
That's okay. Just so you know, we do have a contract with the VA, so if your aunt was a veteran, they will typically pay for 2 to 3 days a week for her to attend the program.
Now, her husband was a veteran, does that count?
Spousal benefits with the VA typically is a bit more tricky, so I would encourage you to reach out to the VA directly to get those questions answered.
Oh, okay. Well, I have another question. My husband and I, like I said earlier, do not get the opportunity to get out since, we can't have a friend or another family member come over and stay with my aunt. Do you have any services that maybe we could take advantage of in the evening or on weekends?
So we have a home care agency that may be able to help with that. Home care provides one-on-one caregivers that come to the home and provide support. And the great thing about home care is it's customized to the client's needs. We do have a 4-hour shift minimum, but if weekends and nights or when you need that support, then we could schedule someone to come during those hours. So it gives you a bit of flexibility, and they can do anything from provide companionship, like housekeeping, and also assist with personal care needs if that's necessary.
Well, that sounds really great. As much as I love taking care of my aunt and love having her in our home, it's been very stressful for me, and trying to figure out how to take care of her and work and deal with all of the things that are going on with the virus. It's been a very challenging time.
Well, one of Wellspring Solutions' missions is not only to provide programming and support for older adults, but also for their caregivers. We have a great caregiver education and support program, and I would encourage you to visit our website. We have lots of videos that you might find helpful, and we also have 2 support groups that meet. And we just started our new Thrive program, where we are offering painting classes, yoga, a book club. So I would encourage you to visit our website for more information about those programs.
Well, thank you, Nicole, for all of this information. I will go home and visit with my husband about it and see if he thinks that we can do this, and I can reach back out to you before long. Thank you.
That would be great, Judy. And also, I'd be happy to schedule a time for us to do a virtual tour so you can get a better idea of what the program offers and see the space and see if it would be a good fit for your aunt.
Well, thank you. I'll consider doing that.
And if you would like more information about our services, here's how you can contact us. Thank you again for joining us today.